Medical uses of mirtazapine. Mirtazapine is approved by the United States Food and Drug Administration for the treatment of major depressive disorder in adults. Depression. Mirtazapine is primarily used for major depressive disorder and other mood disorders. Onset of action appears faster than some selective serotonin reuptake inhibitors and similar to tricyclic antidepressants. In 2010, the National Institute for Health and Care Excellence recommended generic selective serotonin reuptake inhibitors as first-line choices as they are equally effective as other antidepressants and have a favorable risk-benefit ratio. With respect to mirtazapine, it found there is no difference between mirtazapine and other antidepressants on any efficacy measure, although in terms of achieving remission, mirtazapine appears to have a statistical, though not clinical, advantage. In addition, mirtazapine has a statistical advantage over selective serotonin reuptake inhibitors in terms of reducing symptoms of depression. But the difference is not clinically significant. However, there is strong evidence that patients taking mirtazapine are less likely to leave treatment early because of side effects, although this is not the case for patients reporting side effects or leaving treatment early for any reason. A 2011 Cochrane review that compared mirtazapine to other antidepressants found that while it appears to have a faster onset in people for whom it works, measured at 2 weeks, its efficacy is about the same as other antidepressants after 6 weeks use. A 2012 review focused on antidepressants and sleep found that in many people with sleep disorders caused by depression, mirtazapine reduces the time it takes to fall asleep and increases the quality of sleep. But that in some people it can disturb sleep, especially at higher doses, causing restless leg syndrome in 8 to 28% of people, and in rare cases causes REM, sleep behavior disorder. This seemingly paradoxical dose response curve of mirtazapine with respect to somnolence is owed to the exceptionally high affinity of the drug for the histamine H1, 5H2A, and 5H2C receptors, exhibiting near exclusive occupation of these receptors at doses 15 mg equal or less than 15 mg. However, at higher doses, inverse agonism and constitutive activation of alpha 2A and alpha 2B and alpha 2C adrenergic receptors begins to offset activity at H1 receptors, leading to decreased somnolence and even a subjective sensation of activation in treated patients. A 2018 analysis of 21 antidepressants found them to be fairly similar overall. It found tentative evidence for mirtazapine being in the more effective group and middle in tolerability. After 1 week of usage, mirtazapine was found to have an earlier onset of action compared to selective serotonin reuptake inhibitors. Other uses of mirtazapine. There is also strong evidence supporting its use in treating the following conditions for which it is sometimes prescribed off-label: generalized anxiety disorder, social anxiety disorder, obsessive compulsive disorder, panic disorder, post-traumatic stress disorder, low appetite or underweight, insomnia, nausea and vomiting, itching, headaches, and migraine. And that's all about the use and uses of mirtazapine. And thank you very much. Bye bye.